I'm a third-generation physician. Medicine has changed so dramatically in the last 100 years that I think my grandfather would be amazed to see what we're able to do now and how we're able to evaluate patients without needing to do surgery on them to find out what's going on. Medical imaging and ultrasound being a big part of that is a huge and important tool in identifying what's going on inside someone. We now have the capability of looking in without needing to actually surgically open someone up. And because we're using this more and more, we need more machines. Having access to 3 units would give us the opportunity to take care of patients in a more expedited fashion. We'd decrease wait times and improve the opportunities for patients to have access to the studies that they need.
We do typically 600 ultrasounds within a month. With the purchase of these new ultrasound units, 2 are replacing technology that's 10 years old. 1 is an additional unit to be able to increase capacity to meet our demand. When people think of ultrasound, they typically think of the pregnant mom. Aside from pregnancy, ultrasound is used for all imaging. These ultrasound units will be used across the campus by all ordering providers, abdomen being the largest percentage of cases that we use this for. The ultrasound units are also portable, so if a patient's too sick to come to the ultrasound unit, we will go to the bedside to perform that ultrasound. So the primary features of the new ultrasound units are better penetration, better image quality, and will also feature liver elastography, a new service that we can offer here in ultrasound.
As the director of the breast center, we use ultrasound quite regularly for examination and evaluation of conditions of the breast. For other types of general surgery, we use it quite regularly for evaluation of abdominal structures. Specifically, the gallbladder is a very common place where it's used. More and more it's being used to look even for appendicitis in children who we like to avoid radiation. It's used in colorectal surgery and many different parts of care.
I have a really strong family history of breast cancer, so we're very diligent about that care. They found a suspicious mass in my left breast.
In Jenny's particular situation, her denser breast tissue made it a little bit more challenging for a mammogram to show anything going on in the breast. By using the ultrasound machine, we were able to make a small incision and just put a tiny needle into the tumor and take out the cells to prove what it was. And that helped us to guide our treatment for her.
So I don't think you realize how much you need care close to home until something really huge happens, like being diagnosed with breast cancer. So having my care close to home was very important to me. I have 2 teenage daughters. They both have really busy schedules. I work full time. I have a pretty busy life myself, and it was just so wonderful to have Cheshire Medical Center literally 10 minutes from my house. And I also feel that it's really important to give back to your medical center to make sure that that type of care never goes away.
Our goal at Cheshire Medical Center is to provide world-class care right here in Keene. And by having the most up-to-date machinery, the most up-to-date technology, we're able to do that.
Cheshire needs your help this year to procure 3 new ultrasound machines. Please join me today in supporting Cheshire's Ultrasound Fund with your gift. And remember, we should never take our health for granted.